Assalamu alaikum wa rahmatullahi wa barakatuh. This is the sixth video in the series of communication skills for physicians, DVD course by the Saudi Commission for Health Specialties. This is Dr. Faiza Reis with you. I'm going to present in the coming 30 minutes doctor-patient relationship. As you remember, the aim of this course was to improve or to complement our traditional consultation style or doctor-centered approach, to add, I promise you, to add some blue content to it, and to add some green skills to it. Till now, we add in the session of illness behavior, and we emphasize the importance of asking patient about how he thinks and how he feels. And we add this new content to the traditional model to ask patient about his idea, his concern, his expectation, the effect of the problem in his life, and his feelings. Okay, and when we do this, we are patient-centered. We consider the disease framework and the illness framework. And when we ask about all these things, our diagnosis is going to be comprehensive, not only physical diagnosis, but also psychosocial diagnosis, okay? And in the verbal communication skills, we discuss step by step how to give explanation and health education to your patient. In this session, we will discuss through 3 videos the 8th step of establishing and maintaining effective doctor-patient relationship. So let us start. The objective, we will learn step by step how to use communication skills, the verbal and non-verbal communication, to maintain effective doctor-patient relationship. The content of this session, we will discuss the styles of doctor-patient relationship, and we will discuss how to build and maintain effective doctor-patient relationship, the first 2 steps, the steps of establishing the relationship and the step of facilitation. Okay, let's start. Why we want to have good doctor-patient relationship? How does doctor-patient relationship affect the patient's care? It is important for reassurance. It is important for compliance. If the patient has good relationship with his doctor, he will comply to his advice and to his management recommendations in general. It will lead to less doctor shopping. If the patient, he is convinced and he likes his doctor, he will stick to him. He will not change from doctor to doctor. It will lead to less conflict and less sewing. As we told you in the first video, that 70% of the legal complaints of the patient because of the poor communication, because of the poor doctor-patient relationship. If we have good relationship, 70% of legal complaints, we can get rid of them. And it will improve the quality of care. If we improve compliance and the reduce doctor shopping and patient is reassured, all these things will result in improving the quality of care. And all these things is proved or proved by research. All these benefits, okay? Let us see here the different styles of doctor-patient relationship. We can recognize 4 styles of doctor-patient relationship. In this picture, you see the doctor work as a computer. This is the traditional relationship, unfortunately, and the patient is weak and crying from inside. Doctor doesn't feel this weakness, and he just tells him, it is my order, you need to follow my orders. Okay? Patient is telling his doctor, you are here working for me. You have to do whatever I want from you. The patient is giving order to the doctor. This relationship is sort of equal. Doctor is authority and the patient is of equal authority. So the doctor telling the patient, let us negotiate. Let us discuss together what is best for you. Okay? What do you think? This is very magical word. What do you think? To ask your patient, what do you think? Okay? Here, patient is weak, and the doctor is weak as well. He tell her, I'm sorry, there is nothing I can do for you. Both are weak. We can categorize this according to who is in control. The first one, the doctor has high control, the patient has low control. We call it paternalism. The doctor works as if he is a parent for the patient. He gives him order, and the patient as a child, he needs to obey the orders. The second one, the patient has low control and the doctor has low control, and this is a default. Both are weak, very unproductive relationship. This is the consumerism. The patient has the power. And this is both are equal. We call it maturity relationship. So we have 4 styles of relationship: paternalism, default, consumerism, and maturity relationship. Okay, let us see what is the advantage and disadvantage of each one of them. Here, both are weak, default. There is no professionalism, and it is not effective. The patient cannot get any benefit from such a weak relationship. The paternalism, which is the traditional doctor-patient relationship, which is the relationship which we want to change, inshallah, by this communication course. It is the disease model, the approach, where the doctor takes the upper hand. He makes the decision for the patient, and he tells him what to do and what he will not do. This is the traditional, as I told you. Nobody accepts paternal authority these days. Even your children at home, they don't take order from you. What about the patient? Nobody accepts taking orders. Everybody like to negotiate, like to be respected. It leads to poor compliance. If the patient doesn't like your authority, he will not accept your order, he will not accept your recommendation, and it will lead to poor compliance. And it will lead to low patient satisfaction. As I told you, nobody likes high authority. They like to be treated as low, and the doctor is superior to him. Other important things I need you to think about it as doctor. Taking full responsibility is exhausting for us as doctor, to take the charge fully. We decide for the patient, and we just let him take orders and do it without thinking, without sharing responsibility. This is exhausting for us. Consumerism, this is typical of private practice, where the patient comes and he brings his demand from the doctor. It is high risk for the patient, because the patient doesn't know what is of real benefit for him or what could be harmful for him. They may ask for unnecessary investigations or unnecessary medications, can cause iatrogenic problem to them. It is exhausting for the doctor to feel weak and to feel that the patient is taking the upper hand and he gives you order. It is very exhausting. It is waste of resources if patients start to ask for unnecessary things. The last style of relationship, as you see here, the patient is equal to the doctor. Both are authority. So it is adult-to-adult relationship. What we call it patient-centered. The doctor is respecting patient opinion, patient feeling. And we call it illness model in contrast to disease model. But do you think doctors are very happy with this change in doctor-patient relationship? To be honest, some doctors, maybe at least at the start of changing their attitude to their patient, they feel like this, to be honest. Doctors, they miss their authority, where the patient used to be like a child responding to their orders. but this life. Patient have changed. Doctors need to accept this change. Okay? Patients, they are not weak anymore. They have their opinion. They want to discuss. So we need to treat them like adults and respect their opinion and move to patient-centered model. What is the advantage of patient-centered model? Advantage of treating patient as adult to adult, maturity or partner relationship we call it, respecting for patient minds and feelings. And this is very important for the patient to respect his mind and his feelings. Okay? If a patient asking too many questions, this is because he is very anxious. Not because he is trying to look down to your authority. Because he's anxious, he's asking too much. Because he's anxious, he wants to discuss with you the management. Okay? So try to understand this as an anxiety. Try to understand this as need for more empathy and more explanation. Okay? Try to see him, to picture the patient appropriately. Even if the patient is sitting with great confidence, it doesn't mean he is not crying from inside. He is crying from inside. So try to see him appropriately. Better compliance and more patient satisfaction. If you are treating patient as adult to adult, as partnership, this will lead to better compliance and more patient satisfaction. Because you respect his feeling, you respect his mind, he will be more satisfied with you. And if he more satisfied and if he like you, he will be compliant with your advice and your recommendations. Sharing responsibility with the patient. If you treat him as adult and you tell him what is the red flags, what is what you call it, the serious symptoms which he need to take care if he develop these symptoms, then he will shoulder the responsibility with you. He will know when to come to visit the doctor or when to come to the emergency because he is well informed. For sharing responsibility, it will reduce the responsibility from doctor's shoulder. Sharing uncertainty with the patient, especially if you are not sure of the diagnosis. Why you keep the uncertainty just for yourself? Share it with the patient. Changing and it's challenging and stimulating for the doctor. If the patient starts to tell you, I think, doctor, this is better, or I read in the computer, in the internet, this information. This is a nice challenge. Take it as positive things. It will make you more updated or more to have a nice conversation with the patient about something urgent. So accept it as a positive thing. Too much empathy and negotiation sometimes exhausting for the doctor. I am very realistic. Partnership and to treat patient as adult, as equal, to negotiate with him, and at the same time you understand his weakness and you give him empathy and you give him a chance to explore his feelings. All these things is nice and good for you and for the patient, but sometimes it may be exhausting. Sometimes. But this is our responsibility. This is what we call it. Because we are doctor, we need to accept these difficulties. Okay, now let's go by step how to build and maintain effective doctor-patient relationship. And we mean by effective doctor-patient relationship, the partnership relationship, okay? The maturity relationship. Okay, it is 8 steps. We will go one by one. We will discuss the details of each one. And now I'm going to go through the 1 and 2, establishing the relationship and facilitation and active listening. Okay, how to establish effective doctor-patient relationship? We will talk about 2 things, greeting and socialization. Greeting, how we greet our patient. Remember this triple S, Stand, smile, and shake hand. Okay? Standing, smiling, and shaking hand. Make it a routine with every patient. This is give very positive first impression about you, and make the patient feel at ease, and he is welcome. You are welcoming him. Appropriate welcoming phrases. It depends in what area you are working, what sort of patient you are welcoming. Sometime you say أهلين, sometime you go say مرحبا, sometime you go السلام عليكم, sometime you go صباح الخير, whatever acceptable and understandable and preferable by your patient, and preferable by you as well. Call the patient by his best name. You're supposed to know the best name for every patient. So when you call the patient for the first time, you introduce yourself to him, and you ask him about his name. It should be a routine. Next questions, what do you like me to call you? Okay? And when he tell you what he like to be called, just write it in the file. So next time you know what is the best time to call him with. Okay? Show him where to sit down, maybe by just hand movement. So he knows to sit in this chair or in this chair. Because it's not nice for a patient to sit in a chair and then you ask him to move to another one. Okay, and introduce yourself. I am Dr. Faiza, I'm a consultant family physician. Okay, or I am Dr. Faiza, I'm a postgraduate resident in surgery. Okay, whatever. He should know your name and your position. Okay, socialization how? In general, you can use one of these questions. For men, because they like their work, you can ask them about work. How is your work this? For ladies, you can ask her about the family. How is your family this days? For children, you ask them about school activity. What do you do at school? How is your football? How is the exam, for example? Sometimes children, they don't like to talk about exam. Talk to the elderly patient about how nice and pleasant old days. أيام زمان, يا سلام على أيام زمان. Okay, elderly patient, they feel that you are very friendly. You respect them if you talk about how blessing was the old days. Okay. Or you can ask specific questions if you know specific things about your patient. Socialization, why? Why you socialize? Is it a waste of time? Just we are enjoying ourselves with socialization? No. It is very important for multiple reasons. We will say it now. It builds trust. When you start socialize with somebody, he feel that he is special to you and you are special to him. And this is very nice first impression to trust you. It breaks the ice. As we said from the session of illness behavior, patient, when you come to the doctor, they feel anxious. They have a lot of personal dialogues. They have a lot of questions and a lot of fears. When you start to socialize with him, you break the ice. You let him feel that he can talk freely about whatever he has in his mind. Encourage openness, so he feel that he is welcoming and you are ready to listen to him. And I think which is positive for us as doctor, it improves our own satisfaction. We are spending a long time or are spending most of our daytime dealing with patients. If you are dealing with them very professional, very strict, we only talk about the disease, it's going to affect us negatively at the end of the day. If we talk little socializing comments, socializing questions, and if we hear something away from disease and suffering, it is nice for us. It reduces colors to our life. We need color during our day. Okay. Let us see what is the myth and what is the truth about greeting and socialization. Some doctors, they may say, we have no time. Socialization and greeting, it takes time. I'm sitting in my clinic and patient come one after the other, and I will go directly to the details of the problem. I don't need to spend 1 minute in this unnecessary things. But the patient tell you, I need you to break the ice. This will facilitate the rest of the conversation. If the patient is tense, he will tell you the information with hesitancy. He will tell you little information at a time, and you need to pull the information little by little from him. But if you put him at ease, this will facilitate all the consultation, and patients start to talk about the important things with very simple open-ended question. Okay? So it is a myth that socialization, it will make you lose time. It will not. The second myth, it is not professional. Some doctors, they think if they stand and smile and shake hand, and if they socialize with the patient, how are you, how is the family, it's not professional. I'm telling you, we need to socialize and to shake hand, not like this. You don't need to hug the patient when he comes to you, just handshake. But handshake, it will reflect how trustful you are. And as we told you, this greeting make patient trust you. Okay? Some doctor, they said, I'm serious. I'm a serious man. I cannot do this. And it is my image. I will tell you, if you manage to study medicine, you can do anything. This greeting and socialization is a very simple thing. Just do it and try to compare the patient reaction to it with socialization and greeting and without socialization and greeting, and you will find big difference. Now we will see the role play. How can we greet the patient and socialize with him in very short time and with very minimal effort and with very minimal skills. Okay?
دكتور
أيس أيوة
عبادة
ما في مشكلة، يعمل معي موعد.
والسلام عليكم.
سلام. خلص على خير إن شاء الله.
إيه.
بناديك بإيش؟
أستاذ هتان.
أستاذ هتان. الله يحييك أستاذ هتان. شكرا. أنا الدكتور فيصل سليمان، طبيب الباطن المقيم. أشوفك اليوم إن شاء الله.
الله يديك العافية.
أنت إيش تشتغل أستاذ هتان؟ ما شاء الله تبارك الله. مدرس إيش؟
أحياء.
ما تبارك الله، معناته حنفهم على بعض بسهولة إن شاء الله.
إن شاء الله.
سلامات.
دكتور.
صباح الخير.
اهلا، صباح النور، مرحبتين.
الله يسلمك.
حياك الله اخ احمد. الله يحييك، تفضل. ايش بناديك؟
كابتن أحمد.
ما شاء الله تبارك الله، الله يحييك. كيف اخبارك؟
والله الحمد لله ماشي الحال.
انت كابتن طيران حربي ولا مدني؟
لا مدني.
ما شاء الله، اكيد فيت العالم كله.
الحمد لله.
الله يحييك.
الله يسلمك.
كيف اقدر اخدمك؟
والله دكتور أنا محول ليك على أساس أعمل أشعة مقطعية للرأس. عندي
Move now to the step 2, facilitation and active listening. How we encourage patient to talk more? We use verbal communication skills and non-verbal communication skills. What is this verbal communication skills? Skills of questioning, reflection, confrontation, interpretation, paraphrasing, probing, mirroring, and summarizing. We will see what do we mean by each one of this. This is a different way of verbal facilitation, but some patients may volunteer all their story with simple open-ended question. We don't need to do all these things. But why we are discussing all these things? Because mastering variety of skills, to use them when needed. Some patients maybe they are not open. They don't respond to your open-ended question with all the information you need to know from them. So you need to have different skills. You have to need second line, third line, fourth line skills to use them. Okay? This is very nice way of facilitation. We want to balance between facilitation and active listening in one hand, and on the other hand, we need the patient to focus and to use time effectively. Because some of you maybe get resistant. Why facilitation? And I will open the floor for the patient to talk, and to talk, he will consume a lot of time. I don't have time for the patient. But I will tell you this funnel of verbal communication skills for facilitation and active listening, which make you give the patient the freedom to talk and at the same time help him to focus. We'll see how. This funnel will help you to maintain the balance, to organize the flow of facilitation and active listening. So we start with questioning, and we start with open-ended question. For example, Salamat, tell me more. Okay? So the patient will tell his story. Okay? Patient may just respond with short answer. He said, I have abdominal pain. And he will not tell more. So this questions or this response need another way of asking. Tell me more. Okay? This is probing. Because he didn't respond to the first questions, we ask him in another way, tell me more. Or I'd like to hear about your abdominal pain. Okay? Confrontation. Maybe the patient, even if you ask him to tell more, he will say, yes, abdominal pain. You can use third skill, confrontation. You look anxious. Or you look sad when you say abdominal pain. Okay? This sort of confrontation makes the patient feel that you care, that you are sensitive. And it will help the patient to start feeling the equal relationship, the respecting relationship, and start to talk about his problem. Okay? Mirroring. Mirroring by body posture and mirroring by the tone of voice. If we and mirroring by the content of the message. For example, if a doctor asks the patient, what makes your headache worse? And the patient reply, I notice that it is worst when I am under stress. So the doctor, he repeat the same words, okay? He restate using patient's word. He used the same words, and this make patient feel that you are following him. And he will continue from here, okay? And this way, it help patient to talk more, to facilitate, and at the same time help him to focus on this. It's worse when you are under stress. So, as if you are telling him, let us talk about your stress. Paraphrasing, it is something similar to mirroring, but you are telling the patient, repeating what the patient say with slight difference. You rephrase it in your way. The patient, for example, tell you it is worse when I am under stress, so you tell him, if you are under stress, it gets worse. Why you are using sometime mirroring, sometime paraphrasing? If you are using mirroring all the time, the patient, he will think that you are just repeating what he is saying. You are not with him. But if we change it by paraphrasing, he will understand that you get it, and but you want to know more. Okay, reflection. Maybe the patient will tell you, I'm worried it might be cancer. So you reflect the question back to him. Do you think it is really cancer? So you make the patient think loudly to talk about his fear. He will reply to you what make him think it is cancer, or he will reply to you, it is no, it is not cancer, I'm just overreacting to it, okay? So you help patient to think openly. Interpretation. Interpretation is to link the story together to find out significance of every part of the patient's story. For example, he talk about headache, and he talk about the new job, or the new or the aggressive boss. So you try to show him, is your headache because of the new job? Is your headache because of the aggressive boss? Okay? You link things together to make patients see the full picture. Summarization. When the patient tell you the whole story, and you want to move, you get his point, you want to move from this part of the story to other things. At this point, you summarize. You tell the patient, as you told me, you have headache. Your headache is more when you are under stress. And these days, you have stress at work. And then you move to ask details about his headache. For example, you want to know the differential diagnosis of his headache, the doctor-centered questions we used to ask, okay? So let me see if I follow you. For example, to start with this sentence, and you give the summary of what you get from his story. Okay, this is the verbal skills for facilitation. Let us move to the non-verbal skills of facilitation. Eye contact. When you keep eye contact with the patient, this is very facilitating skill. Silence. Ask the question and keep silent. To give the patient chance to think and rethink and formulate his ideas and to start talking. Paralanguage, mirroring tone of the voice. If the patient is speaking with low tone, you ask him the questions with low tone. This makes the patient feel that you are empathic with him, that you are on the same page with him. Facial expression and hand nodding. If you're and head nodding, sorry. Facial expression to show the same expression like the patient, to mirror him. And to move your head like this, that you are following him. To give some sound like, oh, yeah, oh. This is facilitating. Okay, touch, if appropriate. If patient need holding his hand or need patting on his back, this is give him a feeling that you understand him, you are empathic with him. He can tell you the rest of his story, the rest of his psychosocial suffering. Posture and gesture, mirroring body posture of the patient, as we said before, it will make the patient feel that you and him on the same page, and it will encourage him to talk more about what is bothering him. And not only mirroring, orientation of the body towards the patient. Okay, instead of patient sitting like this at the right side of the clinic, of your office, and you are facing your computer like this, as if you are giving him your back. This is not facilitating at all. You need to make your face, your leg, your hand, your body towards the patient. Now, what is the myth and what is the truth about facilitation? The same problem with the doctor. We have no time. Facilitation, if I ask open questions and I let him talk about his full story and his psychosocial problem and the details, this is time consuming. I have no time. I am a subspecialist and I am concentrating on this thing only. I'm telling you, remember the funnel of facilitation. You can start with open-ended questions and then you focus more. But you give the patient a chance to talk. Okay? Some doctors, they may tell you, it's not my job. I'm not a psychiatrist. I'm not a social worker. Let the patient, if he has a psychosocial problem, to go to the specialist for this. I am endocrinologist. I just care about his blood sugar. I don't care if he has problem with his wife or problem with his boss. But you don't have to solve all patient problem. If the patient tell you he has a problem with his wife or his boss, you don't need to find him a new job, as I told you, or you don't need to find him a new wife. You just need to give him empathic ear, empathic listening. Huh? Just listen to him. When the patient talk about his problem, more than 50% of the negative effect of the problem, it will be solved just by giving him empathic ear, just to listen to him. So you don't need to be a social worker or a psychiatrist to help him. As a doctor in any specialty, you can help your patient just by listening to them. Your success in diagnosis and in management depends on your comprehensive approach. Let us say you are an endocrinologist and you care only for the blood sugar. You want blood sugar okay, hemoglobin A1C okay. But if the patient has problem with his wife or problem at work, do you think his blood sugar or his hemoglobin A1C will be okay? He will not be able to be good compliant with your advice or with the diet or with the medication. And even if he take the medication and he is depressed or he is anxious about problem at work or at home, this will affect the hormonal balance in his body, and it will not help his diabetes. So it is not optional to give a comprehensive care to our patient. In whatever subspecialty you are working, patient is a full human being of physical, social, psychological component. To be a good doctor, to be effective in our work, we need to take care of all these things. And it is a very simple thing. We are not asking you to solve patient problem. Just listen to his problem. This is enough for the patient. Now we will see the role play and you will see how simple it is. It's not that difficult. It's not that complicated.
اهلا، صباح النور، مرحبتين.
الله يسلمك.
حياك الله اخ احمد. الله يحييك، تفضل. ايش تحب اناديك؟
كابتن أحمد.
ما شاء الله تبارك الله، الله يحييك. كيف اخبارك؟
والله الحمد لله ماشي الحال.
انت الكابتن طيران حربي ولا مدني؟
لا لمدني.
ما شاء الله، اكيد لفيت العالم كله.
الحمد لله.
الله يحييك.
الله يسلمك.
كيف اقدر اخدمك؟
والله دكتور أنا محول لك على أساس أعمل أشعة مقطعية للرأس. عندي صداع.
سلامتك.
الله يسلمك.
حكيني اكثر.
يعني عندي صداع تقريبا له يمكن أسبوعين زي كذا.
اسبوعين؟ ايوه.
والصداع هذا يروح ويجي.
طيب.
يمسكني كده في مقدمة رأسي، أحسه زي الضغط، شيء كده يضغط على رأسي. الله يسلمك.
كمد، انت ايش تتوقع سبب الصداع؟
خايف يكون شيء خطير.
خطير؟ لا سمح الله، زي ايش؟
سرطان، شيء زي كذا.
بعيد الشر عنك.
آمين.
فكرت كذا، شكلك منزعج.
والله الدكتور يعني الموضوع قالقني صراحة، يعني خايف، أنت عارف سرطان وزي كذا وشغلي وأكيد الموضوع مزعجني.
معليش، أنا متفهم وضعك والله. أنت في مركز حساس، وأكيد إن موضوع الصداع هذا ممكن يضايقك شوي. بس إن شاء الله إننا نتساعد ونلاقي لك حل.
إن شاء الله بإذن الله.
لا
بإذن الله.
تقلق. بس يا ليت يا كابتن أحمد إنك تكلمني أكثر كذا عن أحاسيسك.
دكتور يعني الوالد متوفي، وأنا الوحيد اللي أعيل الأهل، يعني الوالدة والأخوات في البيت، فأكيد لازم أقلق. يعني أنا خايف لا سمح الله يكون شيء خطير وأموت، ومين حيبقى للأهل؟ يعني مين يصرف عليهم؟ من يجلس معاهم؟ فالموضوع مرة يعني ما أنام في الليل، على طول أفكر في الموضوع. مرة موضوع يعني قالقني صراحة دكتور.
معليش.
سليمان،
الحمد لله.
سلامات.
سلمك دكتور، والله عندي مشكلة في ظهري، ألم شديد له تقريبا شهرين.
دكتور.
والله الألم قالقني ومخوفني صراحة، حتى في نومي ما أنام أفكر فيه.
شوف موضوع مزعج كثير.
والله مزعجني، حتى يعني في البيت زوجتي عارفة يعني تشتكي برضو معي، ما بنام أفكر.
أيوه. إيش تعتقد ممكن يكون سبب المشكلة؟
دكتور المشكلة أنا كنت ألعب مع زملائي كورة
أيوه.
وطحت على ظهري.
أيوه. في شيء بالك؟
دكتور خايف إنه الموضوع يتطور ويجيني شلل.
لا بأس عليك إن شاء الله.
إن شاء الله دكتور.
أي كمان.
ودكتور بالنسبة للصلاة ما أقدر أصلي، لازم أجلس على كرسي.
ما تقدر تصلي وأنت واقف؟
ما أصلي وأنا واقف، وما أقدر أشيل أشياء ثقيلة أساسا.
بتقول الأشياء الثقيلة هذه بتتعبك أكثر.
تتعبني وما أخذت مرهم، بس يعني ريحني، مو ذاك الشيء.
برضو الألم مستمر معك؟
ألم شديد دكتور.
معينة تبغاها مني بالضبط؟
دكتور أنا يعني حولوني هنا عشان تعملوا لي أشعة مغناطيسية.
أيوه. طيب، قلت لنا إنه عندك ألم في الظهر له تقريبا شهرين، والألم هذا يعني أنت خايف يكون سبب إنه الشلل.
دكتور يعني هو مو شهرين، يعني هو تقريبا 3 شهور.
3 شهور؟
ايوه مو شهرين. يمكن انا قلتها، يمكن قربتها، لكن انا دكتور صراحه هي لها 3 شهور.
3 شهور. في حاب شيء تضيفه؟
والله دكتور شوفوا لي شيء المناسب لحالتي.
إن شاء الله بإذن الله.
الله يديك العافيه دكتور.
طيب نرجع لتفاصيل الألم. كيف توصف لي شكل الألم؟
دكتور هو ألم في نص الظهر وشديد، وأنا حتى اشتريت عصاية.
أيوه.
عشان الألم هذا، وما أقدر أجلس على الأرض، واقع دحين يعني أتجنب إني أسوق.
قدامك العافية إن شاء الله.
الله يعافيك دكتور.